I'm Dr. Milind Kirtane from Mumbai. I am a practicing ENT surgeon for almost the last 50 years. And I've been visiting Prime as a visiting specialist or a visiting consultant for almost 16 or 17 years now. And I'm here today again at the invitation of Dr. Mustafa from the ENT department. And he's asked me to talk a little bit about cochlear implants. How long have I been doing cochlear implants? Well, I started in 1995, so it's almost 30 years. And with my team, we've done over 4,000 cochlear implants now. Yeah, the question is, who is going to really benefit from cochlear implants, or who are the right candidates for cochlear implants? Today, cochlear implants are done both in children who are born deaf and in adults who once had normal hearing, normal language and speech, and because of whatever age, disease, toxic drugs, lost their hearing. So initially, cochlear implants was meant only for adults, and somewhere in the early 90s, it was started for children who were born deaf. The primary concept here is that if you have a deafness that's labeled as sensory neural deafness, that means it's the inner ear that's causing the deafness. It cannot be cured by medication or surgery, and you have to advise these patients hearing aids. But the hearing aids will benefit only if there is some function left in the inner ear. If the inner ear is so badly damaged that even the most powerful hearing aid does not help the patient significantly, then a cochlear implant comes into play. The surgery is not very complicated. Yes, it is a precise surgery, but most ENT surgeons, I think, are trained to do mastoid surgery for mastoid infections. And this surgery is a bit of an extension of the same surgery. So I would say with a little bit of training, an ENT surgeon who is doing otologic microsurgery should be able to perform this. What is post-operative management of these patients? That's a very important question, because just the surgery is not going to give them the optimum result. The surgery, and when you switch on with the outside processor, so the surgery consists of two parts. You put an implant inside, which is going to stimulate the nerve of the ear. But for this implant to receive information, you require an external unit which does the work of the inner ear outside the ear. That means it's a computer that will pick up the sound, translate it into electrical signals like the normal inner ear would have done, and then transmit this information to the implant. So what you've done with this is given the patient access to hearing sound again. But since you're giving it from a computer, not coming from the natural pathways, there is some amount of training that is required for the brain to make use of this information. And that training can go on in children for almost 2 to 3 years before they become capable of really speaking in sentences and understanding speech. So that training is called auditory verbal therapy, which means auditory, so you listen to the sound and then learn to use it to convert it to verbal, so that you're training your brain now to use that incoming sound to learn language and learning how to speak. But in adults who had language and speech earlier, this process will be much shorter. But in children who are born deaf, who have had no access to sound, if you operate early enough, within the age of say 3 to 4 years or even before 2 years, with this auditory verbal therapy, the implant can give them really good results. Well, if you have chosen your candidate correctly, if you've done the surgery properly, which is of course important, and if the tuning of the implant, that's called mapping, and especially the auditory verbal therapy is done properly, then we hope that many of these children, for example, can be mainstreamed to join a normal school. And I've got any number of patients who have done their schooling, college, done jobs, post-graduation. I've got some who are working as lawyers. There are 4 of them doing medicine. Many of them have done different specialties, IT for example, gone abroad. Just 2 weeks ago, there was a student of mine, a patient of mine who came, whom I had operated when she was 3 years old, to get married in India, and she's doing a job in, I think, Copenhagen. So she's learned the language. So you can really bring them to a level where they can compete with their peers and do just about everything that their normally hearing peers can do. But it means proper selection of the candidate, good surgery, and most important, good auditory verbal therapy. Are there any dangers or complications of cochlear implants? Well, any surgery, however small it may seem, will always have some complications associated. This is otologic microsurgery. So just like there are complications in otologic microsurgery, there would be possible complications here. Although I must say that the number of complications that we've encountered are very few, because unlike microsurgery done for mastoid infection, here you're operating on patients who do not have infection. One complication that is always worrisome is infection, and if the wound gets infected, then the implant may get infected and may have to be removed. The incidence of this is extremely low. Similarly, this infection could go up the nerves towards the brain. So one fear is that of meningitis. Again, as I mentioned earlier, because we are not operated on infected ears, the incidence of this is extremely low. Another complication associated not only with cochlear implants but with any mastoid surgery is damage to the facial nerve, which runs through the mastoid bone. And again, with proper training, proper surgery, facial nerve monitoring, and a proper reading of the CT scan before the surgery, the incidence is extremely low. So the complications, though present, are really minimal in this procedure. You know, the level of healthcare, what you're talking about in the United Arab Emirates, I can only talk about the hospital where I come and work, and that's the Prime Hospital, the Prime Health Center. And the facilities that I have found here, whether I'm in the OPD or in the operation theatre, are comparable to any other center that I have worked in. I mean, all the equipment is there, the staff is very well trained, and when I'm operating here, it feels like I'm operating at home. So facilities-wise, I think it compares to any other place in the world. The future of ENT looks bright. You asked me about artificial intelligence coming into play. Yes, in a lot of diagnostic tests, whether it's radiology, whether it's histopathology, reading of scans, even interpreting auditory tests, I think artificial intelligence will play a major role. People are looking at robotics in ENT surgery. So far, the robots were huge and big. They were meant for abdominal surgery, but I think robotic surgery it's already playing a big role in certain aspects of ENT, and that will also play a major role. About the Prime Hospital, I think you have very well-trained staff here. For example, we have Dr. Prashant Sharma, who's a consultant here now, and he's already been trained in cochlear implants. So I feel that Prime Health and Prime Hospital would be really a good place where you can start with a cochlear implant program, having a trained person with you already in your ranks.